Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Marketing Manager Rachel Rom. In today's episode, we conclude our two-part drug diversion series. We sit down with CompleteRx Director of Quality and Compliance, Dana Fox, to discuss what hospital executives can do to help prevent drug diversions in their own facilities and how to best address them if an event is discovered. All right, well, welcome, Dana. Thank you for joining us in today's episode.
Thank you for inviting me to participate. This is a timely discussion to review a key area for safety and regulatory compliance for institutions, so I'm happy to participate.
For sure. So I really want to get into, your area of expertise, which is what you're talking about, and discuss what hospital execs can ensure is happening in their organizations to prevent and properly address drug diversion. So first, in order for us to do this, I really want to talk about what response typically looks like. What sorts of programs do hospitals have, things like that.
Sure. Hospitals and health systems in general have several areas to consider. There's training, oversight, and the deployment of technology are all key elements to address a diversion program. A key point is a diversion committee comprised of clinical and executive leadership that monitors defined metrics and audits that are critical elements for the organization to have in this time of diversion and are prominent topics within healthcare.
So is that pretty common then, for a health system or a hospital to have a program in place or a committee in place, or is that something that, maybe some of them lack?
Some may have committees, ad hoc committees, but a structured program that really aligns with what you're going to be doing with audits
Mhm.
and focused reviews, it's not widely deployed yet or used efficiently in all organizations.
Okay. Yeah. So that kind of leads into my next question. What can organizations do differently, or what do we do with our own clients that, allows us to really help reduce drug diversion incidents? I think one thing Terry and I spoke about in our last episode was burnout and how that can lead to drug diversion. So that it's important to keep up morale, especially during this time where, we've been functioning in a really stressful environment, across the globe, uh, so are there anything like that is there anything like that we do differently, or, what suggestions do you have?
Well, during COVID, workloads place greater demands, like Terry highlighted in your discussion.
Mhm.
One of the elements that we're doing in organizations, and you can do within the whole system, is regarding burnout and diversion, training and education programs, work-life balance, signs of stress, signs of diversion are training topics organizations should be covering with their team members, as well as educating their executive team and their diversion committee, so everyone is aware
Mhm.
of the topics, and it helps you identify diversion within your facility.
For sure. So making sure that the resources are known is probably a big piece of it.
Correct, and being proactive. So you are
Yes.
educating team members so we can have open and honest discussions.
Yes, absolutely. That's really great information, I think, for our listeners. So something that we recently have spoken about a lot as an organization, I think throughout this whole pandemic, is that leaders have been forced to take their eyes off of normal operations and best practices. I think we've all been in crisis mode, not surprisingly at all. So an interesting point, again, that Terry brought up in the last episode was the impact that staffing models have had on the increase in drug diversion, particularly the increase in traveling nurses. This was something that I was not aware of at all. So, what are your thoughts on this, and how do we ensure that it's not adding to the problem, and that we can, be proactive about it?
Yes, we saw during COVID that organizations have been strained and have taken measures to have a full complement of staff. Traveling nurses is one solution that's been deployed, and we have witnessed higher number of diversion events within that group and PRN staffing
Hmm.
that occurs within organizations. Um, these examples of staffing changes or deployment Highlight how your systems and audits need to be set up to be able to identify and analyze variants that may warrant a deeper investigation.
Hmm.
So, your technology, your regular daily reports, audits are looking at variances or highlighting practices that have changed or may warrant a deeper review.
Okay. No, that makes a lot of sense. Just keeping your eyes and ears, on everything. So, Dana, were there any additional tips or best practices that you wanted to make sure that our audience was aware of as they begin to evaluate their own drug diversion response plans?
Yes, there's several things. One I would highlight is there's a most recent report from Protonus. It's the 2021 Diversion Digest.
Hmm.
It's a report that is put out annually to look at reported diversion events that have been in headlines.
Hmm.
One of the things I would highlight there is 32% of all the events that were reported this last go around were in hospitals and clinics.
Wow.
And this is during COVID. So the numbers that were reported were less than the previous year. So one wonders if we have taken our eye off the ball or we were just distracted and maybe didn't report as many events.
Hmm.
What I would say is we have seen a greater number of events in accounts that we manage and new types of diversion. So, in setting up a good diversion program, you need to spend an equal amount of time on risk assessments and audits.
Okay.
You need to run a multi point audit throughout the year. We do that where we look at 6 areas within the controlled substance program
Hmm.
or management program to overlay with the diversions. If you're not finding drug diversion or conducting focused reviews and flagging events, identifying users, it is a time to ask if your program truly is effective.
Sure.
Just because your committee's not getting reports or you're not seeing things doesn't mean things are fine. There may be um, things you need to look at within your program to identify or have sensitivity for these events. One thing I would continue to highlight is this continues to be an area of focus for accreditation organizations,
Mm.
governmental investigations, and we're even seeing fines continue to be at the forefront of healthcare headlines. Um, Make sure your team stays current and is adapting with the changing methods of diversion, updates in your technology, or elements within your audits that may need to change based on what you're finding.
That makes a lot of sense. I think we're probably so used to looking at things, one way, and this is how it's been for a long period of time, and it's quote unquote worked for us. But times are different now, and there are different ways of accessing things that we didn't have before. So I think that's really great advice. Is just really looking at your overall, program or plan and figuring out a way to look at it a little bit different. So thanks for your time today, Dana. You really shared some really great information, and we really appreciate you sharing it.
Thank you. One thing I would like to highlight at the end is just, if if you're running a program, you really need to make sure it has redundancy within your diversion program involving the multiple team members, as I listed, security, infection control, physician leaders, anesthesia, others within the hospital. Um, Also, make sure you're looking at what your metrics, audits, and technology solutions are. Those are critical elements in a highly performing, highly efficient diversion program. And if again, if you're having events reported up through the committee, if you're not having events reported up through the committee, consider bringing in an external resource to evaluate and help you improve your diversion program. A fresh set of eyes and trends that others are seeing may be beneficial to your organization.
Absolutely. Cannot agree anymore. All right. Well, thanks for your time today, Dana. Really appreciate it.
Thank you.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from Complete RX.